There's no question that vaccines and vaccination programs are vitally important to public health, and that a vaccine for COVID-19 might be our best shot of beating this pandemic. But getting people to take the vaccine, getting them to trust the government's information around the vaccine is going to be a real challenge. Around the world, more than 100 teams are in a race to develop a vaccine for COVID-19. The front runners are already in late-stage clinical trials. We don't know when, but one or more of them may just get there. We might even have a vaccine for winter. But what's worrying public health authorities is the possibility that a significant number of people may decide they don't want to be vaccinated.
Because there's all these anti-vaxxers now, isn't it?
Well, Marina can tell you a little bit about how we...
I'm not a farm animal!
Now, this isn't just a case of countering the claims of anti-vaxxers. They are a small but hardcore community who dispute the efficacy or the safety of vaccines. The internet is full of conspiracy theories around COVID-19, around treatments, and indeed around vaccines. So that's going to be one problem. But what about ordinary people who get their flu shots, take their children to be vaccinated, want to be a part of the solution to this pandemic, but have doubts about whether a vaccine that's developed so quickly, a vaccine that is so new, can be taken without unintended consequence? That's a question governments are going to have to face.
Very important.
Just because a vaccine is being developed at such great speed doesn't mean that it's less safe or effective than a vaccine that takes, say, 10 years to develop. A great deal of money and resources are being put into compressing the timetables that would normally be stretched out. Just the same, reasonable people may have uncertainties. Even a large-scale clinical trial only tells us so much. It tells us that a vaccine is safe and effective for the period of that clinical trial, for the demographic, the age group, but that doesn't tell us that the vaccine is entirely free from long-term effects. It doesn't tell us that the vaccine is going to be safe and effective for all people, no matter what their underlying health condition. So it's going to require a degree of public confidence in the government's assurance that it's safe to take repeated doses or doses with a large amount of time between the first and, say, the second dose. So all of these things present a challenge to governments as they seek, on the one hand, to convince people to take a new vaccine, and on the other, to rebuild trust that's been lost through the early response to the pandemic, when so much of policy has been presented as certain and settled science, when in fact it was not at all the case. So we were told that masks were not needed until they became mandatory, that widespread testing was not essential until we understood that it was absolutely the key to understanding how transmission was working throughout the community. So governments have an enormous job to do to rebuild public trust, which includes not only the benefits of taking a vaccine, but also some of the risks and at least the uncertainties involved. I'm Therese Raphael with Bloomberg Opinion.